Well, welcome. This is our the kickoff to our Community Development Block Grant Year 52. So this is our first public hearing as we're beginning the process of putting together our Program Year 52 plan, annual action plan. I think both of you guys are familiar with the program. We've been a participant probably since the inception of the program back in the 1970s. And hopefully that will continue, although one never knows these days. We haven't received any information in terms of what we might be looking at in terms of funding for next year. Program year beginning October 1. This past year, we had the grant was less than the year before, which was less than the year before that, and before that. So we're at $441,600 is the entitlement grant. And there's been a progressive downward trend the last few years. So maybe that will continue, maybe not. We'll see. We are able to supplement it with some program income. Some of our programs are loans that get repaid, and that then gets reallocated to continue the services we provide. There are a couple, we like the CDBG program. Most municipalities do because it's pretty flexible funding. You do have to allocate monies towards eligible projects. They have to be consistent with your consolidated plan in terms of the objectives you set forth. But generally, you have a lot of latitude in terms of addressing what you see as your priority community and housing needs within the community, as long as it meets one of those three national objectives. Hello, we've got Mary Ellen. Tia.
That's spelled.
Ed, welcome. I'm just giving my introductory remarks.
Good evening, everyone.
Sonia's taking notes as to who's here, so we can keep a record of that. This meeting is being recorded for purposes of note-taking. I was just saying that we're beginning our planning for Program Year 52 for the federal fiscal year that begins October 1st. We don't have any indication as to what monies may come our way from Washington, but hopefully there will be some at the end of the rainbow. We do typically program monies in accordance with the maximum allowable. We're able to allocate 15% of our grant towards public service activities and 20% to cover our program administration and planning expenses. And we typically allocate up to the maximum in both of those categories. And then the balance is in accordance with priorities that we've identified in our consolidated plan. So, as you know, one of the projects or activities have to meet one of three national objectives. In most cases here, we're serving or benefiting persons of low, moderate income or areas of low to moderate income. We do have some that, while they're not majority low, moderate income, they do meet the requirements for participation in the program. There's a concentration there. If you have any questions in terms of what those census tracts or block groups are, you can let me or Sonia know. There's a map in the application or program materials. This is the first of two public hearings that we'll have. Usually have one at the beginning and then one towards as we begin the process of securing various approvals from town boards. So there's usually a public hearing there as we begin to make some allocation decisions, or at least preliminarily, as to how we're going to allocate the Community Development Block Grant funds for the upcoming year. So I know Sonia will probably emphasize this, but we're asking applications to be submitted by March 16th. Right before St. Patrick's Day.
Last year it was St. Patrick's Day.
So But really, this is an opportunity to hear from you in terms of the needs that you're seeing within the community. Certainly, activities or programs that you might be looking to fund with these federal dollars. I think we do have a list of all those folks who are attending. This is being recorded so we can keep a good record of what you guys all have to say without me scribbling furiously. But we'll turn things over to everyone that's here. Bernie, since you were first to arrive and you're in the room, you can go first if you'd like.
Well, thank you, and good afternoon, everyone. I'm here representing, well, I'm wearing two hats, I guess, but first of all, I'm representing Mosaic Senior Life, which is the old Jewish home up on Park Avenue, and our CDBG funding has typically gone for Fairfield residents who are in need of our adult day program, and we're only one of the few nonprofits locally offering a medically certified adult day program. It typically accommodates people with some form of either a cognitive or a physical disability, and there really aren't too many options locally for daycare for them. So the program, apart from attending their medical needs, helps keep them at home, relatively independent. Most of them will have caretakers, so it does provide some caretaker respite as well. We've been providing the service to Fairfield residents for many years and have a good track record. Typically, we have 20 to 30 a year that attends, and the frequency is from 5 days a week to sometimes just one, where there's a need for caregiver respite. So we look forward to continuing the relationship. I think it's a critical and vital program with a tremendous benefit. And do I wear my second hat?
Yes, you can wear your second hat as well.
My second hat is I'm here also as a commission member on Fairfield's Human Services Commission, which uses and requests CDGB funding for their outreach social worker, which again focuses on very vulnerable populations in Fairfield, and has been a program that has also been in existence for several years and generously funded. So it's not widely known that Human Services has social workers for various in different disciplines, but the outreach is really helps people navigate various systems, accessing supports where they're available. So it's a critical role for a very vulnerable and I suspect older population in the town.
Yes, it is.
Thank you for that.
Thanks, Bernie. Well, now we can go around the horn for anyone who'd like to. First, I don't know if there's any other questions or if folks want to just pop in and provide some comments. Also, I see we're joined by the first select person. That's very great. Taking a break from all the budget meetings that she's having to attend, so that's great.
Mm-hmm.
Hello.
Oh, that's really nice.
Hello, Christine.
So we're just getting started. Charlie, I think you were the next to arrive if we're taking things in order. If you'd like to say a few words about your group and what you're seeing out there.
Yeah, I really, really appreciate it. So those, you guys know us fairly well, but we are celebrating our 40th anniversary this year. We are in two businesses, and the one that we received the support in the past from Fairfield is our HUD certified housing counseling agency functions, which are really meeting people where they are financially and trying to get them on a stable footing. Our HUD certified counselors, you can look at them as social workers as well. We help people modify their behaviors, improve their credit, help them reduce their revolving credit, just getting them on a financial stable footing. And the intent is to be their coach, their confidant, and then if we're successful, to get them on the track of home ownership. We see roughly between 1,200, 300 people a year. We provide repeat services. This year, our real priority is to try to do as many repeat services rather than the number of people. We're trying to build up that trust and just follow people through their journey, whichever, whatever they're trying to succeed in. So we're, again, financial literacy, getting people in stabilizing their finances, getting that household so that it's more affordable to live where they are right now. We help people with rental mobility and then first-time home ownership, landlord certification. Generally, on a yearly basis, we'll help about 150 people throughout the state of Connecticut purchasing homes. We pride ourselves in knowing every bank's affordable loan programs out there. We know every down payment assistance program, and including Fairfield. We administer Bridgeport's down payment assistance program. And we've been expanding our services, and we definitely want to provide our services in Fairfield. Our approach is pretty much, I call it B2C and B2B. People reach out to us directly and take our classes and our counseling services directly, either virtually or in person at their preference. But we also do what I call B2C, and that is we work with other nonprofits and we bring our workshops into their places of business. Places like Goodwill or Alliance for Community Empowerment or Center for Family Justice. We provide our services to Park City, Bridgeport Public Housing, Norwalk Public Housing, Greenwich Public Housing, where we're going in and trying to help stabilize their finances so they can avoid evictions. A few other programs that we're in on that might not be a part of our application, we've created a loan fund, a housing stability loan fund. So the intention is to help people stay in their homes if they have issues with repairs. We provide below market rate loans that are not subject to a certain credit score, and we make it, and they're up to 10,000 out to 5 years. So we try to make it as affordable as possible. We also, in the youth financial literacy services, we have a full-time person that provides workshops for young adults. We do after-school programming for the public schools, and we also help the Bridgeport Public School administer their financial literacy class. It's a lot of a mouthful, but we depend on CDBG funds for sustainability as well as for programming specific to Fairfield. So we will pay more attention. We will try to increase the clients that we serve in Fairfield, and do more targeted outreach as well. We also, the other side of our coin is that we are an affordable housing building developer. And this part of our business has undergone some changes. And in the past, we used to provide property management with a lot of different buildings. Today, we're just in the affordable housing development space. We've got about 3 different projects right now on the drawing board, and we'll go wherever we need to go. They happen to be in Bridgeport, but we would be welcoming deals in Fairfield as well. So that's a lot out of my mouth, and I'm sorry to take up so much time.
That's okay,
But,
Charlie.
yeah, we're really, we're very, very committed to what we do. And preventing foreclosures and evictions and getting people in new housing and stabilizing their financial situation and condition. Those are really, really important to us.
Of course, I know who you're with, but would you like to state that for the record?
Yeah, that's a really good start, isn't it? Yeah, that's great. We are Building Neighborhoods Together, formerly
Nice.
known as Bridgeport Neighborhood Trust. Yeah.
Appreciate it. Thank you,
and,
Charlie.
I can tell you about 65%, 67% of our clients are from Fairfield County, but we also have more classes available than most any agency in the state. So we attract a lot of others across the state, 12, 13% in New Haven, 10, 12% in Hartford, and urban and rural. So we're servicing the state, but in person, we're here in, your backyard.
Thank you. Thank you.
Yeah. Thank you both. Thank you all.
Who would like to go next? Ed?
If it's okay, can you hear me?
Yes, absolutely.
Great, thanks so much. We're the new kids on the block.
Okay.
And so we're hopeful, given the constraints that we'll be able to justify an allocation from you all. Wheel It Forward is a lending library for durable medical equipment, like wheelchairs, hospital beds, rollators, et cetera, et cetera. I think we've all known these things as lending closets, and we know that they're in the back corner somewhere, and it's useful if you can happen to find your way to it. We thought about that concept and decided to bring technology and scale to it. And so the way to think about it, I think a little bit is those lending closets are like neighborhood kiosks for books, you know, where you've got that little thing. If you want it, it's great. But if you specifically want something or you're going to do research on something, you need to go to the library. And we are that library. And to put it in context, we've been around for 4 or 5 years, and started in Stamford during COVID. We started in Stamford with a 2,500 square foot warehouse. And we opened a warehouse in Bridgeport about 1.5 years ago because we could see that we weren't servicing that end of the county. And we know how important it is to do that for so many reasons. And so we decided to open that up there. And there's a compelling reason to do this, which is that the durable medical equipment proportionally is 3 times more expensive than prescription drugs. And the reason for that is because there's no insurance to speak of, or the insurance is so hard to get or so delayed that when you break your leg, you can't be in a situation of waiting 6 weeks for the approvals to get it done. You know, the other thing is Fairfield County is one of the richest counties in America, but 40% of the folks here don't have $1,000 in their bank account to buy one of these pieces of equipment. So we just thought, why don't we try to create something in size? And to put it in context, it's worked quite well. We have 15,000 SKUs in our inventory. 90% of our inventory is out being used. We helped 7,000 people last year, either to borrow or to donate to us. And the impact since we've moved into the Bridgeport Stratford warehouse now is that, you know, we're helping 5 times more people in your end of the county. And we just want to grow that dramatically because we really have the wherewithal to do that. And so, you know, we're hoping that we're going to be able to do that. I know, for instance, I took a look that last year we helped 100 individuals in Fairfield, specifically in the town of Fairfield, and 80+% of those are very, very poor individuals. About 75% are elderly. And the impact can be quite substantial in a way that allows people to maintain their dignity and their safety. And so we're excited about being there, but we really need to get the word out. And really, we do need to get funding. I guess I'll just say one thing about the funding. Unlike many people who do this, what we give out is for free, but we suggest to people, if they can make a donation, to try to please do that. And in fact, we've cultivated so that about 1/3 of our resources, our income, comes from people making suggested donations. So it can be a very powerful tool for us. But given the Bridgeport, Stratford area, we get much less because the wherewithal is much less for the individuals there. And so to find alternative sources of funding, whether it's corporate, foundation, or CDBG, are really essential for us to do that. And hence, we're going to put our application in and hope that we make a compelling argument. So I appreciate the opportunity to present on
Well, thank you for sharing, Ed. We look forward to receiving your application.
Thanks.
Tia, Mary Ellen, Herb? Mary Ellen? You're on mute, though. You're on mute, Mary Ellen.
Hi.
There you
How are
go.
you? Hi. Ed, I was really taken with your presentation. What is the name of your organization again?
We're called Wheel It Forward.
Wheel It Forward?
Uh-huh.
Oh, that's very, very good. I'm up in Madison, and we've had to borrow things from Charlie's Closet. Have you ever heard of that?
Yeah, we've had lots of conversations with them. Let me put it that way,
Good.
and very supportive, very
Yeah.
constructive relationship.
Yeah, but you're right. They're kind of tucked away in a off the road type of place. So
Yeah.
yes, I think what you do is very necessary.
Mhm.
It was good to hear you. I'm Mary Ellen McGuire. I'm the executive director of Bridge House. We were started 40 years ago in Bridgeport as a clubhouse for people with serious mental illness, or as we say, SMI. When I say clubhouse, I mean that we are accredited with Clubhouse International, which is in New York City. And Clubhouse International has accredited 350 clubhouses around the world, which we are one of them, and the only one accredited in the state of Connecticut. There are psychosocial organizations around the state of Connecticut. There's about 25 of them. But as I said, we're the only ones accredited with Clubhouse International. So we have extensive networking opportunities around the world to help our members. We have about 200 members, we call them right now. They are clients, if you will, who belong to our clubhouse. We refer to them as members. They refer to themselves as members. And they are involved in every aspect of working at the clubhouse. And this is for their benefit, their recovery. They serve on the board. They work throughout the house in different jobs, not to be paid, but to volunteer. And they work in the kitchen, they work on the yard, they work everywhere. And as I said, they also serve on our board. We have 4 members who serve on our board, and they're part of all the key decision making that's going on. We've been in Bridgeport for 40 years. This past year, we purchased another building in Stratford, 2103 Main Street, Stratford. It's the old Johnson home. It's a house with some historical value. And we are in the process of renovating that building to accommodate our program. And we're looking forward to moving there in the summer. We don't know exactly what month we're going to be there, but that's when we'll be moving in. And as I said, we have about 200 members now. Several are from Fairfield, but we are wide open to anyone from Fairfield who has a diagnosable mental illness being a member in our clubhouse. We have about 13 staff, and the staff work side by side with the members throughout the day to get the tasks of the building done. They also help our members find jobs, get back to school, stay, if they have an apartment, stay in the apartment. We keep our folks from becoming homeless. We also have a food bank, so we're able to give them food. And during COVID, for example, we actually delivered the food to our members so they wouldn't go without. We do everything with our members and do everything for our members. When I say for them, meaning their connections with us are really life-saving. Throughout COVID, for example, if we weren't there, I don't know what would have happened to many of our folks. We're open every holiday, the day it's celebrated, because many of our people are detached from their families, is a good way of putting it. And they spend Christmas and Thanksgiving with us and so forth. So are there any questions at this point?
No, we know your organization pretty well at this point. As we appreciate you joining us again, sharing an update. So it's congratulations on the new Stratford location. That's terrific news.
Thank you. We're very excited. The members are very excited. We actually have a big lawn. It's a really exciting time to be part of Bridge House.
Thank you,
And
Mary Ellen.
if it weren't for the CDBG funds over the last, 8 years, Sonia? About that. It really has made a difference at Bridge House, and we're appreciative of everything you do for us. So we look forward to working with you again.
Thank you for sharing.
Thank you.
Thank you.
Good evening, Tia.
Hi, good evening, everyone.
Thanks for joining us.
Yes, thank you for having us. It's good to see some familiar faces and hear about Bridge House. We're definitely partners with Bridge House. Thank you for what you do. And Christine, congratulations on your win. So thank you for joining us. I'm Tia Reed, the Senior Director for Behavioral Health with LifeBridge Community Services. We've been in the city of Fairfield for over 12 years. We do have several offices in Bridgeport and in Fairfield, but most importantly, this past year, we've really been able to expand our services, which is behavioral health. And what we do is provide talk therapy and art therapy. And what we've noticed is that the barriers have been access to treatment, and the funds provided by CDBG have really been instrumental in allowing us to not only continue what we're doing, but to take it to a different level where we're bringing services to individuals. We've just recently partnered with Pediatric Health Associates in Fairfield on Unicoi Road. We actually have an office inside PHA, not only in Fairfield, but now their Stratford location. We will have one in their Trumbull location in April. We're in several high schools in the city of Bridgeport, definitely trying to get in the high schools in Fairfield, placing clinicians so that, again, we mitigate the access and barrier to behavioral health services so greatly needed. We are definitely an agency that depends on Medicaid funding. That is a topic for a different meeting. I'm sure we can all agree. But 80% of our clients do depend on Medicaid to pay for their medical. And we also depend on it to help cover costs of services. And with that being said, the rates is something that we're finding ourselves being a volume business, making sure quality is always first and foremost. But we do need to make sure that we find funding that supports the work we're doing. Not only do we provide the behavioral health therapy services to individuals ages 6 and up, family therapy, we provide therapy to couples, to seniors. In our Fairfield location, right on Penfield Road, we make sure access is available to those in the city of Fairfield. But we also provide community training. So we've partnered with the Parks and Recs Department. The director there, chief rather, Anthony Calabrese, has been instrumental in his entire team partnering with us to provide community training, which is a community resiliency model. Anyone with the nervous system can certainly take advantage of this training that we provide the community to really be able to deal with the changes that are occurring all around us, to be able to work more efficiently with the clients that we're serving as their needs are increasing. We also need to make sure we're taking care of our own well-being. So we're providing those trainings in the community by partnering with the city of Fairfield, Bridgeport, and Stratford. Partnership has been great. Sonia, I feel like we talk almost every week. And she did come to our new open house where we expanded services in our Bridgeport location, has visited us in our Fairfield location, where we are very much equipped and ready to expand services further in the city of Fairfield by partnering up or even opening our doors wider in that location on Penfield.
Thank you very much. Thank you for sharing.
You're welcome. Thank you.
I see Herb Lime Cooler also wears multiple hats. He's the chair of the Affordable Housing Committee and also Fairfield Senior Advocates, a member of. Herb, would you like to say anything, or are you just observing tonight?
I'm really just observing and just.
I see you taking notes, so that's good.
Yeah, it's great. It's great to see everybody, to be with all of you. As Mark said, I'm a collaborator with him in terms of the Affordable Housing Committee in town, and we try to find affordable housing, but also work to try to find housing alternatives, because we have an entire population with needs to a better match between our housing stock and what people's individual needs are. And we could talk a lot about this, but just in a nutshell, that's what we really do. And it's great to be with all of you and learn more about your organizations.
We appreciate you joining, Herb. Thank you very much. And again, I'll acknowledge our first select person, Christine Vitale, who's joining us. In the room also, I forgot to acknowledge you all already know Sonia, but Sonia Hine, our grant manager, she supervises, oversees the Community Development Block Grant Program, makes sure that all the I's are dotted and T's are crossed as far as HUD is concerned, which is a never-ending job.
She definitely does. She keeps us all in line for sure.
Yeah, well, one of these days we'll actually get things squared away so we can get reimbursed from the feds. Right now we're having some issues with their payment system, but that's for another story, another time. So, but thank you, Sonia, for
You're welcome.
all that you do. And as I said before, this is just the beginning of this process. The applications, you're pretty familiar with the applications, but if you have any questions, feel free to reach out to Sonia directly. We're asking application to be submitted by the 16th of March. And then after that, we'll be going through a series of meetings with various town boards. It does ultimately get before both the Board of Select persons as well as the representative town meeting that approve an allocation plan for the town in terms of how we are proposing to utilize federal resources and to help all of you meet the needs that you're seeing within the community. We'll have a second public hearing on the 4th of May. I'm sorry, did I say March? May 4th. May 4th. And hopefully we'll conclude things in time so that we can get the annual action plan up to HUD 45 days prior to the end of the federal fiscal year, which is September 30th. I would be remiss if I didn't also mention, I think you're all on the mailing list, but we do also, the town is one of the communities that does participate in the Neighborhood Assistance Act program. This is actually a state program administered by the Department of Revenue Services that provides tax credits to businesses that make charitable contributions to approve programs that serve the local communities in which they're based. Nonprofit organizations, municipal agencies are all eligible to apply. It doesn't mean you're going to get money, but it's a fairly simple application process. The town has to basically vet the applications and approve them locally before they're reviewed and approved by the Department of Revenue Services, after which then, and some of you have mentioned that you do receive gifts from businesses or corporations. But this is a nice way, kind of win-win strategy whereby they make a charitable contribution to you, and in exchange, they can apply for and receive a tax credit from the state against their corporate tax liability. So that may work for you, but be mindful that usually comes out sometime in March. We'll get the information from Department of Revenue Services, and then we'll put it out to all of you. Oftentimes doesn't translate into a lot of dollars, but then again, you're all here in our Community Development Block Grant Program. Unfortunately, we are not able to allocate a lot of dollars either because of the limitations that we work under. So every little bit helps, I'm sure, but that, feel free to keep that in mind as you go forward. And with that, I'll entertain any closing comments or questions. Any questions from the group? Do want to thank all of you for taking time out of your schedules to be with us this evening and share a little bit about your organization and the important work that you do within our community.
Thank you.
And the needs that you're seeing locally. There's certainly, these are trying times, and we haven't seen the need decreased in any way. There's certainly folks, even in a fairly wealthy portion of our country, that need the services that you all provide. They're vital, and we do appreciate your work and look forward to continuing to partner with you.
Thank you.
Thank you so
Thank
much.
you.
Appreciate
Thanks so
this.
much.
So with that, I will go one more time, but if hearing none, I'll entertain, I guess we'll close the public hearing at 6:35. So thank you all, and we'll be in touch.
Thank
Thanks so
you.
much.
Thanks.
Bye-bye.